The $50,000 healthcare trap. If you're planning to FIRE before 65, here's the number that should terrify you. $50,000. That's what the average American couple will spend on healthcare between early retirement and Medicare eligibility, and that's if nothing goes wrong. I've researched 47 countries for FIRE healthcare options. Most are garbage. High costs, visa nightmares, or healthcare systems that sound good until you actually need them. But 3 countries absolutely dominate. We're talking comprehensive coverage for less than your Netflix and Spotify subscriptions combined. Better doctors, shorter wait times, and you can actually afford to get sick. Right off the rip, I'm giving you Portugal, Malaysia, and Mexico. These 3 beat everything else, and I'm going to show you exactly why. Portugal, the European healthcare cheat code. Portugal is the cheat code for American FIRE expats, and here's why it works so well. You get English-speaking doctors, access to the entire EU healthcare system, and a visa pathway that doesn't require you to be a millionaire. The D7 visa is specifically designed for retirees and remote workers. You need to show passive income of roughly €820 per month. That's it. No massive bank deposits, no business investments, just prove you can support yourself. Now here's where Portugal gets interesting. You have 2 healthcare systems running in parallel. The public system is called SNS, and it's nearly free. We're talking €5 for a GP visit. Prescriptions are subsidized. Even surgeries cost a fraction of US prices. But here's the thing. The public system has wait times. Not emergency care, that's immediate. But if you need a specialist or elective surgery, you're waiting weeks or months. That's where private insurance comes in, and this is where your mind gets blown. Comprehensive private health insurance in Portugal runs €50 to €100 per month. That's $50 to $100 for everything. No deductibles, no co-pays, full coverage including dental and vision. You walk into a private hospital, see a specialist the same week, and your out-of-pocket cost is $0. Let me give you real numbers. A GP visit in the private system, €50 without insurance. With insurance, $0. Cancer treatment that would bankrupt you in the US, fully covered under private insurance. Hip replacement surgery, about €8,000 cash pay, or $0 with insurance. In the US, that same surgery is $40,000 minimum. The D7 visa process is straightforward but bureaucratic. You need a Portuguese bank account, proof of accommodation, and that passive income verification. Initial visa is for 2 years. After 5 years of residency, you can apply for permanent residency. After 6 years, you're eligible for citizenship if you want it. Now let's talk about the tax situation, because this matters for FIRE. Portugal has the NHR program, non-habitual resident status. For your first 10 years, you get massive tax breaks on foreign income. But here's the brutal truth. They're changing the rules. The government is phasing out some NHR benefits. You need to research the current state before you move. Don't rely on outdated expat forum posts from 2019. The language barrier is real but manageable. In Lisbon and Porto, you can survive on English. Doctors speak English. Hospitals have English-speaking staff. But if you're living in smaller towns or dealing with bureaucracy, you need basic Portuguese. I'm talking survival level, not fluency. You can get by, but your life is easier if you learn the language. Here's the catch nobody tells you. The public system wait times can be brutal for non-emergency care. If you have a chronic condition that needs regular specialist visits, you're paying for private insurance. Period. The public system works great for healthy people and emergencies. For everything else, budget for private. Portugal works if you want European stability, access to the entire EU for travel and healthcare, and you don't mind dealing with Portuguese bureaucracy. Because let me tell you, the bureaucracy is real. Everything takes longer than it should, but the trade-off is worth it for most people. Malaysia. The medical tourism goldmine Portugal works if you want Europe and don't mind bureaucracy. But if you want zero paperwork nonsense and dirt-cheap premium care, there's an even better option that most Americans completely ignore. Malaysia is the secret weapon for fire healthcare, and here's why it destroys the competition. The MM2H visa, Malaysia My Second Home, is designed specifically for foreigners who want to live there long-term. The medical tourism infrastructure is world-class because Malaysia has been competing for international patients for decades, and English is everywhere. I'm talking doctors, nurses, hospital staff, pharmacists. You don't need to learn Malay unless you want to. Here's what makes Malaysia different. There's no confusing public-private system. You're using private healthcare, period. And this actually works in your favor because the entire private system is built to compete for medical tourists. Hospitals are newer than most US facilities. Equipment is cutting edge, and doctors are often trained in the US, UK, or Australia. Let me hit you with real costs that sound completely fake. Comprehensive private health insurance in Malaysia runs $100 to $150 per month. That covers everything: hospital stays, surgeries, specialist visits, prescriptions. A specialist consultation costs $15 to $30 out of pocket if you're paying cash. In the US, that same visit is $200 minimum before insurance. But here's where it gets stupid cheap. Prescription drugs in Malaysia cost 70 to 90% less than US prices. Name brand medications, not generics. A 3-month supply of blood pressure medication that costs $300 in the US, $30 in Malaysia. Insulin that bankrupts Americans, a fraction of the price. This alone can cover your entire cost of living if you're managing a chronic condition. The MM2H visa changed significantly in 2021, so ignore anything you read before that. Current requirements depend on your age. If you're under 50, you need to show offshore income of $10,000 per month and place a deposit of roughly $215,000 in a Malaysian bank. If you're over 50, the requirements drop to $10,000 monthly income and $107,000 deposit. After a year, you can withdraw half that deposit for approved expenses like property or medical care. Yeah, those deposit requirements sound insane. But here's the thing. It's your money. You're not giving it to the government. It's sitting in your account, earning interest. And if you're already FIRE with a portfolio over $500,000, parking $100,000 in Malaysia for visa purposes isn't a deal breaker. The medical tourism advantage is real. Hospitals in Kuala Lumpur and Penang actively compete for international patients. You get concierge service, English-speaking care coordinators, and appointment times that actually mean something. No waiting rooms for 2 hours. You show up at your appointment time and you're seen. Geographic location matters too. Malaysia gives you easy access to Thailand and Singapore for specialized care. Bangkok has some of the best hospitals in Asia. Singapore has world-class cancer treatment centers. You're a short flight from multiple healthcare options. Now the downsides, because they're real. The humidity is brutal if you're not used to tropical climates. You're 20+ hours from the US, which matters if you have aging parents or family emergencies. And the visa program has political uncertainty. The requirements changed once, they could change again. You're betting on Malaysian government stability, and that's not the same as betting on Portugal or the US. Visa stability, taxation on your US investments, and healthcare quality for your specific conditions. Let me break down when each country wins. Portugal wins if you want EU access and long-term stability. The visa program has been running for years. The government isn't going to suddenly change the rules and kick you out. You get access to healthcare across the entire European Union, which matters if you travel or need specialized care. And the expat community is massive. You've got established networks, English-speaking services, and people who've already figured out the bureaucracy. If you value stability and community over everything else, Portugal is your answer. Malaysia wins if you want premium care and don't mind the distance from the US. The hospitals are genuinely world-class. The insurance is cheap and comprehensive. And you're positioned in Asia, which gives you access to Thailand, Singapore, and other medical tourism destinations. But you're betting on visa stability that's already changed once. And you're 20+ hours from family emergencies. If you're young, healthy, and want the absolute best care-to-cost ratio, Malaysia dominates. Mexico wins if you need US proximity and flexibility. You can drive across the border. You can maintain US connections. You can visit family without burning 2 days on flights. And the visa process is straightforward with lower income requirements than Malaysia. If you have aging parents, kids in the US, or just want the option to access US healthcare when needed, Mexico is the only real choice. The hybrid strategy is worth considering. Some people split time between two countries, 6 months in Portugal, 6 months in Mexico. Or they use Mexico as a home base with regular trips to Malaysia for major medical procedures. You're not locked into one country forever. Here's what kills FIRE healthcare plans in reality: chronic conditions that need specialist care, aging parents that force you back to the US, and visa rule changes that make your plan obsolete. The MM2H program changed dramatically in 2021. Portugal's NHR tax benefits are being phased out. Mexico could tighten residency requirements tomorrow. You need flexibility in your plan. Travel insurance matters if you're moving between countries or traveling frequently. You need coverage that works internationally, not just in your country of residence. Emergency medical evacuation insurance is non-negotiable if you're in Malaysia or anywhere far from the US. Some people maintain catastrophic US coverage even while living abroad. It's expensive, but it gives you the option to return for major health events without facing bankruptcy. You're essentially buying flexibility. Here's the honest assessment nobody wants to hear. This only works if you're relatively healthy now and willing to be flexible long-term. If you have serious chronic conditions, you might need to stay in the US or pay significantly more for international coverage. If you have aging parents who need you nearby, Mexico is your only option. And if you're not willing to adapt when visa rules change, you're going to have a bad time. Second, get actual insurance quotes in each country from real providers, not blog posts from 2019. Third, join expat Facebook groups and talk to Americans who've actually done this. The reality check: visit before you commit. Test the healthcare system. See a doctor, tour hospitals, talk to expats who've been there for years, not just people on vacation. Hit that like button to support Molly before you go. And check out my video on FIRE tax optimization for expats to understand how these countries affect your investment taxes. I'll see you in the next one.